purpose of this video is to introduce you to Epicentre and give you a better idea of who we are and what you will become a part of. Epicentre is a South African company that was founded in 2001. We specialize in public health research projects and in particular in the collection of data in the community that informs the study findings. In addition, we are involved in assisting workplaces in the design and implementation of their wellness programs. Over the last 15 years, Epicentre has been a major role player in understanding how HIV, TB, and chronic diseases affect our communities and our workplaces. The main aim of our work is to try and find a way for us to prevent more people from becoming infected and to assist those already infected to live healthy lives. Epicentre is managed by myself, Sherry Kaywood, the CEO, and David Carnelli, my fellow director. We have a national network of supervisors, field workers, nurses, trainers, drivers, and counsellors who assist us in implementing our programs. Epicentre has branches in Cape Town, Hillcrest, Pietermaritzburg, and Johannesburg. I'm now going to talk to you about some of our research projects. We generally find ourselves working in partnership with major overseas research funders, local universities, and organizations that are studying the pandemic. The bank of knowledge that we are helping to build is being used across the world to help communities that are affected by HIV, TB, and other chronic conditions. Epicentre's partners and funders include the Centre for Disease Control in America, CAPRISA, which is the medical research department of UKZN, HERD, the Health Economic Research Division within UKZN, the Medical Research Council, SAKIMA, which is the South African Centre for Epidemiology and Modelling, and also the National Institute of Communicable Diseases. I'm now going to talk a little bit about our workplace programs. By way of introduction, I want to talk a little bit about the 90-90-90 strategy. In September 2014, UNAIDS launched an ambitious project aimed at ending the AIDS pandemic. The aim of the project was to get 90% of all people to know their status, 90% of all people on ARV treatment, and 90% of all people virally suppressed. And this they wanted done by 2020. Now this is quite a challenge, especially in countries like ourselves that carry a high burden of the disease, with over 6 million people, almost 7, infected with the disease. This is, however, a challenge worth taking up, as it's believed that we could stop the progression of AIDS if we could achieve these aims. If 90% of the people in the world that were in fact virally suppressed, that were HIV positive, were virally suppressed, we would be in a position where HIV would no longer be transmitted. We would be able to concentrate on the treatment programs and taking care of people that were living with HIV, rather than trying to prevent new infections. The current picture of HIV is a bit like an iceberg where the tip is visible, and those that have full-blown AIDS we can see, but those that are HIV positive underneath are hidden. The greater problem looms below the surface. However, as all those that are HIV positive are not yet aware of their status and on treatment, and are currently transmitting the virus to other people. And this is what is perpetuating the progression and transmission of HIV. Epicentre in the past has implemented traditional HIV workplace programs in large organizations such as NAMPAC, Unilever, Rainbow Chickens, just to name a few. Today, traditional workplace programs are being replaced by targeted interventions following in the footsteps of the 90-90-90 programs. And Epicentre assists organizations in designing programs that are personalized to the companies themselves and contribute towards 90% of people knowing their HIV status, 90% of those being on ARVs, and 90% being virally suppressed. I'm now going to talk a little bit about reference programs that we've done in the past to give you a sense of some of our programs and so that you can see that we have the experience to implement the program we're currently working with you on. The first one I'm going to talk to you about is the HIPS program that we implemented in the Ongonglovo district of Pietermaritzburg. This program involved 2 cross-sectional surveys of 10,000 people that we randomly selected from the community. We followed them up 12 months later, the negatives, to see who had seroconverted, and it was an incident study to see what was driving the epidemic. The second one was something completely different, and there we evaluated a program to try and reduce the bereavement in young girls that had lost family members. There we evaluated the program, interviewing them before and after the intervention of the program to see whether it had a measurable benefit. And that the size of that program was only 400 girls, and it was implemented in Bloemfontein. The third one I'm going to talk about is where we went to 2,000 clinics across South Africa, and there we were evaluating the impact of the HIV counselling and testing program in 2012 to see how well it had been implemented across South Africa. And it was a massive undertaking to go to 2,000 clinics across the country to look at the integration between HIV and TB. So I'd like to welcome you now to the Epicentre family. You know a little bit more about us, and I hope you'll be very happy with us and you'll contribute to our current projects. Thank you very much.